Hello, my name is Maksim Liaukovich. I'm an oncologist who works at Roswell Cancer Care Network at Samaritan Hospital in Watertown, New York. I went to medical school in Belarus, which is Eastern Europe, and we do go like for 6 years straight in medical school. It's a little bit different system. After that, I practiced in Belarus, and due to political situation, I moved to Canada and eventually to US, and now I'm here. Both my parents are doctors, my aunts, uncle, so we're kind of a family of physicians. While watching them at work, their passion, how do they care about patients, how do they see results of their care, and that influenced me to choose the profession, and I've never regretted about that. During rotation, hematology, oncology, I worked with my colleagues, and I saw the results, what they've done, and how patients are happy, how much can we do for cancer patients, and I decided to go into oncology. And the more you are in the field, the more you like about it, the more new opportunities we see in oncology, the more options we have for patients, the more you like what you can do for patients. That's why I chose oncology, and both hematology, they come together. Nowadays, you cannot manage everything in community. You have to rely on larger centers. And it's good to be affiliated because it's easier to communicate, it's easier to refer, it's easier to get patient back. I wanted them to participate in clinical trials. I wanted them to have the same outcomes as patients in a large city, at the same time to live with their families in a community. That's what my preference, to stay in the community to help with all type of cancers, but at the same time to be able to help patients as much as I can with affiliation with Roswell Park. We can hear quite often when patient hears about cancers, they kind of how long they have to live. It's like few months, and it's kind of they, with the options which we have, especially with the development of the research and new medications, and we have to educate them. That's why I encourage them, just come, let's talk. We'll give you options, and then you decide if you don't want that, and it's fine. As soon as you know what options are, they should know that they can get that care, regardless of the financial situation, regardless of their families, because sometimes they live without any support, and that's a limiting factor for them. They just say no because they kind of assume that nobody can help them. And that's my goal, is to bring them here, to bring them to the clinic, and to educate. The most important for us to see the outcomes, to see how patients are happy when you can help them with this kind of deadly diagnosis, which is not always true, but in the community, the cancer is a cancer. It's very important for us to see how happy are they, how excited are they with outcomes. And that brings a lot of passion to us to help even more. All doctors are here just because of the patients and outcomes which we can provide to patients. And that's exactly true for oncology. Sometimes we have short relationship with the patient, but we want to make sure they have nice and good time with their family, with us, at the end of their life. And sometimes we can beat the cancer, and the more research is going on, the more likely we will beat the cancer. I believe that's the best specialty to be in, probably next 20 years or so.